Hi everyone, my name is Beryl Yufenyu and I'll be doing the group presentation. My group consists of Josephine Edokpai, Christina Wabaki, and myself. So the agenda for our presentation for today will be the definition of statistical and clinical significance, individual importance of each term, examples of each, and how the difference will be utilized. So, statistical significance is used to determine whether a result or relationship between two or more variables is due to chance or an effect of a variable of interest. It is the measure of the probability of the null hypothesis being true compared to the acceptable level of uncertainty regarding the true answer. A high level of statistical significance reveals that the effect observed is unlikely the result of chance, and the results observed in the sample also exist in the larger population. Clinical significance refers to the extent to which a treatment effect is occurring in a clinical research experiment. It determines whether the treatment could be used in clinical and non-experimental settings and be effective. It is also the practical or applied importance of effect and whether it makes a difference to patients. So now I'll be talking about how both significance are individually important. Statistical significance evaluates the strength of data against the null hypothesis. It represents the probability that the difference between the groups being studied is not by chance. Researchers usually calculate the p-value and compare to the threshold value to determine whether to accept the null hypothesis, and this forms the base of statistical significance. Clinical significance are findings that result in improvement of patients' quality of life. Patients' individual physical function, mental status, and the patient's ability to engage in social life. Clinical significance addresses the benefits of the study to the individuals of the group and how it can make their lives better. So now we'll be talking about examples of both significance. With statistical significance, you conduct a research test at a significance level of 0.05. You obtain a p-value of 0.0038. The results will be considered statistically significant and you would reject the null hypothesis. With clinical significance, the clinical significance can be estimated by effect size. It can be calculated with the number needed to treat, in quotes, NNT. An example is that a study was conducted, 56% received the treatment drug versus 33% of the placebo were treatment responders, thereby yielding an NNT of 4.3 calculated as 100 divided by 56 minus 33. So this signifies the study is clinically significant. Okay, now we'll be explaining how you can utilize the difference as you review literature. In reviewing the literature, knowing the statistical significance alone is not sufficient to make practice treatment decisions. Knowing the difference is critical to determining what literature should be used to inform clinical practice decisions. Clinical significance can be used to directly impact current practice and use of a treatment right away. A study may be statistically significant and not clinically significant, or the converse. The role of the DMP preferred provider is to balance between the statistical and clinical significance. And here are our references. Thank you for listening.